Good afternoon, Phoenix. Man, it's great to be here at the Phoenix Convention Center with you all. Look at this crowd. I tell you, come on. We've got doctors, we got nurses, volunteers, regular folks like you and me all here for this community health fair. This is what it's all about, coming together, rolling up our sleeves, making sure everybody's got a shot at a healthier life, especially at a time when we have so many people um, who think that vaccinations, who think um, that defunding certain parts of the federal government that deals with that is a healthy thing. You know, we got a shot at a healthy life here. It's beautiful. It's a beautiful thing, isn't it? Now, let's get real for a second. Healthcare is not just some policy thing back in Washington. It's personal. It's about being able to go to bed at night knowing you can take your kid to the doctor without losing your shirt. It's about not having to choose between a prescription and putting groceries on the table. That's the heart of it. And that's why today means so much because this fair's bringing healthcare right to you. Free screenings, shots. Folks, to talk about to talk about mental health insurance, you name it. It's all right here, and it's for everybody. I got to give a big shout out to the folks who made this event happen. The volunteers setting up the booths before the sun was even up this morning, before we even departed the East Coast. The healthcare workers giving their time, the community groups pulling it all together. Come on, give yourselves a round of applause and a hand. You're the real deal. You're not here making a difference, and I can't thank you enough for what you do. Now look, we've come a long way. We beefed up the Affordable Care Act. Yeah, Obamacare is still kicking stronger than ever. We've got millions more folks covered right here in Arizona and all over the country. We've capped insulin at $35 a month for seniors, cut some drug prices, poured money into community health centers. But let's be honest, there's still work to do. Too many folks are still struggling to get a doctor. Too many families are one medical bill from trouble. And that's why we're fighting to bring down cost even more, to get Medicaid expanded everywhere, to make sure rural towns and underserved neighborhoods have clinics and doctors they can count on. You know, I heard a story not too long ago that struck with me. A woman went to a health fair like this one and got a free screening and found out about a health issue, early early detection of this health issue. That screening saved her life. She's still here taking care of her family because of a moment just like that. And I'm sure, I don't want to wish that upon anybody, but I'm sure that same thing could happen today. Early detection of something that could really be harmful and deadly, but early detection. And it's all because of what we do with the healthcare here. You know, and it was found that was detected just at a health fair, just like the ones we're creating here today. That's what this is about, folks. One checkup, one vaccine, one conversation. It can change everything. So here's the deal. Don't leave here without taking advantage of what's out there. Get your blood pressure checked. Ask about that flu shot. And I know it's coming around the corner before too long. Whatever's on your mind, and talk to the folks about how to get affordable coverage. And don't stop there. Grab your buddy, your neighbor, your coworker, and say, hey, you go get a check. Go get a check and check this out. Spread the word, because that's how we lift everybody up. You know, Phoenix, you're showing the rest of the country how it's done. This city's got heart, it's got grit, it's got that spirit that says we're not leaving anybody behind. We're out here in the desert making things happen, bringing people together. I love it, and I know we can keep it going. My team's hard at work, working to lower drug costs even more, to make mental health care easier, to bring back telehealth to places where the nearest doctor is an hour away. And I have to tell you, I actually used telehealth a couple of years ago. Yes, I use telehealth, and it actually does a good job. So it needs to be in these isolated rural locations of the country. Now, not it's not just about what we have done in Washington. It's about what we're doing right here, right now. So let's keep it going, folks. Let's keep fighting for America where nobody's got to worry about how to pay for a doctor's visit, where every kid, every mom, every grandparent has a fair shot at a healthy life. That's the America we're building together. And I just wanted to close with this one story. And I often think about this, especially when we're talking about the Affordable Health Care Act. And I don't understand for the life of me how somebody could defund the Affordable Health Care Act. The story is this. You know that I know a lot of educators. A couple of years ago, there was an educator who had she went for a checkup and she had to get a prescription, a medicine. It wasn't something that she wanted, something that she chose. It's something that was required. You know what that prescription cost her? $700. Now she was faced with a situation. What do I do? I got 3 kids. What do I do? Do I get this medicine or do I not pay rent? Do we not get groceries? That's not right. That's not right, folks. And that's what we're fighting for. That's what we're fighting for every single day in Washington, every single day at the White House. I am fighting for you. I'm fighting for the middle class. So again, thank you very much. And again, I encourage you to take advantage of this health fair. And again, it's indeed an honor and privilege to come here today to be with you and to be here for this great event. Thank you all very much. Thank you, thank you, thank you.